It's amplified. Everything's amplified.
Hello.
Hello.
Hello. I do apologise to all 110 of you. My computer took this exact second to reboot itself and reinstall 500 updates. So as is the norm of these things. So apologies for my late arrival. I will not waste time in a lot of kerfuffle then. Just to say thank you very much for attending Grand Rounds today. It's Grand Round Extra, 2 in a week. We've never done this before, so it's overexciting. Yesterday we heard from the Director of Medical Education, along with Ellie from the medical school, and various members of the NES team, along with Jordan, who gets a prize for not only most Grand Round presentations in a week, but most Grand Round presentations in 24 hours. And we heard about how we're working collaboratively together to try to make sure that teaching happens in the next semester. This is an extension of that. We're going to talk about the undergraduate curriculum, how we can keep our students safe, how we can keep our staff and patients safe, but still continue to produce the award-winning, high-flying medical students into junior doctors that we do here in Dundee. And it is obligatory to remind everyone that we do have the joint best medical school in the UK here in Dundee. So Stella, are you sort of going to coordinate things from here?
Yeah, thanks so much, Tom. That's great. I think Jordan is going to be the one, with your permissions, to share her screen.
Yes.
And then Jordan's going to be an expert mover of slides, just to help coordinate us, if that's okay.
Of course it is. Jordan, you should be able to share your screen now, and there you go. As usual, anyone has any questions, please put them in the chat. You can direct them to me or to everyone, and I will try to put them all together at the end. Thanks very much to the team from the university.
Thanks so much, Tom. Really appreciate it. And I wanted to start by extending my thanks to you for suggesting maybe we could do, I think you called it the double header of a Grand Rounds, having 2 this week. And I guess something of the keenness to present something around about blended learning. And what is blended learning that we keep talking about is, time goes on. Weeks and days slide together, and before we know it, we're advancing on another academic year. Many are still continuing with teaching efforts on postgraduate side and more. So I really do appreciate it, and it's wonderful to see so many people who've been able to come along today. Delighted to be joined by colleagues Persefoni and Jordan today. And also I think the highlight has to be Sheire. No pressure there. Sheire is one of our MBCHB students who's going to be presenting a bit about the student voice and what students have thought to date as they've experienced a bit of online learning. So thanks to everyone. Next slide, please. I really do want to start with thanks, and of course it might be seen that here I'm copying. There was Thanksgiving yesterday in the Grand Rounds, and I don't think we should stop doing that. So I really do hope that people have heard and they've seen the thanks that have been extended by Professor Rory McCrimmon, our Dean, Professor Maggie Bartlett, Dr. Ellie Hothersall and others, to thank everyone within the school, our clinical teachers, academic staff, professional services staff, specialist support staff who've really been working at pace since the point that we had this very significant disrupting clinical environment, educational environment, and disrupting our whole communities. And I guess to echo what was said yesterday, what an extraordinary team effort, people exercising phenomenal problem solving and team working under pressure to support patients, communities, and to support our students. We can't say thank you enough. The other acknowledgements I have here is to thank our student reference group, and Sheire will say more about the student reference group. They've helped inform this presentation. I want to acknowledge Dr. Susie Schofield, who with Jordan presented a lovely webinar, and we've cropped some parts from that for today. And then I want to extend thanks to all of the noted here, Kirsty, Katie, Alana, Gulam and Elizabeth, for sharing examples that they've created to help support student learning. So lots of acknowledgements there, but wanted to see those up front. Thank you. Next, please. So here's an outline of the session. This is what we hope to address. A bit of what will teaching look like next semester. Really, are there a great deal of differences between supporting learners when we're blended, I'll say more about that in a moment, versus in a classroom, so physically on campus, or in a classroom or in another location where we're physically face to face? Are there some things that are actually, perhaps there's more in common than we think? We'll take some feedback, hearing from Sheire what the students found as they experience that really fast pace move to online, of course, because they physically were not able to come in to our normal teaching areas. Offer some examples, and then make sure that everyone feels they know where they can get support. We do hope to enable quite a large chunk of this session to have questions. And I'm delighted to see, as I scrolled through all the participants, that we're joined by people who can talk to issues of the physical return to some of the classrooms. We've got our operations manager with us. We've got great colleagues from clinical skills and from other people who can talk to different elements of our MBCHB programme and beyond. Thank you. Next, please. So what do we hope to achieve? Well, by the end of this session, maybe 2 aspirations: that if you're involved in teaching or supporting learners, maybe this will provoke some thoughts about how might you think about your teaching when we're going to offer it in a blended way. Reflect on maybe any development or support or advice needs that you have, and feel confident about where to go and how to access that support. So I hold myself to that. Let's see how we go. Next, please. So what will teaching look like? I think there's a great deal of uncertainty. We're still living with uncertainty, but I wanted to share with you this quote that is from Professor Blair Grubb. He's our Vice Principal for Education, and he's written to all of our students, all of our current students, and he's saying, when you come back, you'll experience a blended mixture of online and face-to-face teaching. So there will be elements that are going to happen in classrooms. There will be learning that will happen in the workplace, and that is going to be connected to and mixed with online teaching. And really it is about maximising flexibility, because as it's noted here, and everyone's of course aware of this, that we need to be able to be adaptable and flex with public health guidelines that are in place. And in part, that's what influenced some of the discussion and ultimate decision-making about return for new learners. So in particular, people who are coming for their first year to the University of Dundee and the School of Medicine, that influenced the decision to welcome them back on the 5th of October. Pushing the semester further back for those learners in particular was about facilitating making ready in a very safe way our physical spaces. So thinking about how many students and tutors and educators it'd be safe to have within a room, thinking about signage, thinking about guidance and training for people as we enter back into some of our teaching spaces. but also giving us time to develop some of those online learning resources, planning it carefully and thoughtfully so that students and staff can enjoy the learning experience, which for everyone is going to be different. We're not going to see large group lectures. The Ganaki will not be full or even half full of students, because as we adhere to the guidance around about social distancing, we have to very significantly draw back on what we would normally do within the classroom to assure that we are all safe. So it reduces that dimension of coming together, but what will we do online to support it? The online offering allows us flexibility. So flexibility that we are going to need, for example, if someone has to shield, perhaps someone has a loss of health, they need to quarantine for 2 weeks. We need the flexibility in the system. We may have students who are delayed in arriving, and by having a well-planned, good quality online offering, it helps support this adaptability given uncertainty. But we still get to welcome our students back to Dundee, the city that students highly rate for a learning experience. So that's an outline of what we're planning to do, and it still affords the excellent experience of learning, which is important in medicine, in particular in the workplace. Next slide, please. One of the things I've been doing, and maybe others have been doing it as well, is following some of my favourite people in terms of what they were tweeting and blogging about as we moved into lockdown. And one of the ones that did catch my eye by Lydia Arnold was a nice reflection that she was doing given her experience in online learning. And she was just talking about some of the high quality features of what we do as teachers to support learners. And what struck me is some of the points outlined here in the slide are very much what we know and what we do when we're seeing people in a classroom or we're seeing them face to face. It is no different from some of the key features of what we'll be able to do online. Students really value where they're guided by teachers that they respect and trust, to look at particular things, perhaps a short video. It might be a short video capture they've done, maybe read key piece of reading. They trust and they value the guidance to selected resources in an ordered way that we've carefully curated. And that's no different from what we do in a classroom when we plan learning. They also value having a range of experiences, and that range could be everything from a small group discussion, a case-based discussion, an interactive lecture. Again, we know that, we do that already. They want an opportunity to come together with peers and learn from one another. We can do that online. It's a different medium, but it's the same skills you bring to bear as you introduce questions and elicit people's ideas and thoughts. And perhaps one that never escapes anyone, myself included, in further studies, always start by looking at the assessment and where I might have some formative assessment. Students place high value when they see their teaching is connected to an opportunity for feedback, to self-assess, how am I doing, to get feedback from colleagues, from peers, and see that their teaching is connected to elements of assessment. We know that already, we're doing that already. So I just want to say something of, we've got this. Next, please. I'd now like to pass to Sheire, who's in a different time zone. I don't know, Sheire, if you want to explain a bit of where you are, and I pass over to you, and thank you for bringing the student voice to this. Over to you, Sheire.
Thank you, Stella. Yeah, I'm just in Singapore at the moment and it's just 8:15 in the night. So yeah, 7 hours ahead of you guys. So just to introduce myself, I'm Sheire and I'm just completed 3rd year and I'm going into 4th year this end of July. I'm very excited to be back. Hopefully there won't be any travel restrictions for that. I just wanted to explain a bit more about the focus group that Stella mentioned that we set up. And it's made up of a group of volunteers from the MBCHB Student Council. And it was just put together so that we can voice our views and concerns and any ideas that we have towards blended learning. And we've had 2 meetings so far through Black Bloc Collaborate. And I'll share some of the thoughts that we've come up with so far. And this diagram, I think, sums it up really well, because you can see the positive experiences and the things to consider as we move on to planning the blended learning. So many students through this time have actually been very involved in online lectures from SMILE or COVID medical education. And these are lectures organized by lecturers down south. And they sort of invite lecturers throughout the UK to give lectures on different topics that they're good at. So, a registrar in renal medicine would give the lecture on AKIs and so on. And this has been very effective over Zoom, and it has attracted not only audiences, within the UK, it's also attracted students from Australia and various other countries around the world. And that just shows how much technology really helps us during a time like this where we can't really have face-to-face teaching. And looking at how they run a couple of things, we thought that we can sort of, pull good things that have worked for them and adapt it to the blended learning that Dundee will commence shortly. So diagram speaks for itself, and one of the things that I'll be speaking about first is engagement and how to increase that in the online environment. Engagement in the online environment is almost as important as face-to-face teaching, if not more important, since we can't really interact with students. And so far, the things that we have seen through the COVID-19 medical education lectures and SMILE lectures, and even lectures that have been delivered by Dundee clinicians, have been the use of quizzes, like using Mentimeter or Kahoot, or even the polls that are available on Zoom and other platforms like Black Bloc Collaborate as well. Having quizzes really helps students stay alert and gets them thinking and involved about content. If you're doing revision of content that has already been taught, quizzes could be used as a form of, at the start of the lecture, start with a quiz, because students already know the content, and sort of encourage active recall of the knowledge that they've already knows before starting to revise them. So this could be useful for final year students, 4th and 5th years. And if it's new content, so starting new blocks, and students have never been taught that content before, quizzes can be used to be interspersed every so often within the lecture to help students to have active recall of information that has just been delivered to them. And this helps them remain responsive and continue listening to the lecture while learning and testing their knowledge as they go. So this has been used, as I said, in Dundee itself. Within the 3rd year transition block in the anatomy lectures, we had Dr. Tracy Wilkinson and Luke Reed use quizzes and even asked students to turn their mic on to get involved. And we had, I think the 4th years had a dermatology session with Dr. Shona that was useful, as she used clinical pictures of dermatological conditions to sort of explain the pathology of things and the treatment and management and what she would do in that clinical situation. So that was really good, because students were able to get really involved and ask questions on the chat function or even by turning on their mic. And I think Dundee has taken a step in the right direction by having Capsule, which has a range of a lot of clinical scenarios that will be really useful, especially for 4th and 5th year students. And just for clinicians, if they just want to pick up a couple of scenarios to help students further understand the content. And Mentimeter is actually really, really good as well, and it helps students get involved. Regarding the lectures, we feel that lectures that have been recorded with voiceover was much more effective in helping students understand the content. And especially when there's learning objectives put in the forefront of the lecture, it really helps to focus students' attention to those things, and they know that that's the kind of thing that they need to take away from the lectures, even though even if it's recorded and they're doing it on their own time, they're able to look at the learning objectives and really structure their learning based on that. It also gives the students the opportunity to revisit the content at a later time during their revision. but we felt that splitting lectures into shorter lectures would be much more beneficial for their learning, because they can just take in information within half an hour instead of the lecture being 1.5 hours, for example. Discussion forums are also used very frequently to ask questions, and they are very valuable. But it would be helpful if the discussion forums were to be used on a single platform, so that students don't have to toggle between too many online platforms. So for example, within a single block of teaching, all queries from students and answers from clinicians should be on one Padlet page or on a Delta discussion forum. And it's best that both not to be used concurrently, so that you don't have to shift between one and the other. Everything is just, on one single page, and that helps to decrease confusion as well. Especially going to online teaching and working from home, I think it would be good for students to have a structured timetable, so that it gives shape and structure to the week, especially helping us to wake up on time and complete the lectures and content on time. As mentioned, I think one of the biggest concerns that the discussion group brought up was the new year one students, our freshers that are coming in, and how we can help them to feel part of the university and part of the school, and just sort of assimilated into their new environment, even though it's much limited face-to-face teaching. What we think would be useful is to get small groups started early on, and mentoring sessions with more senior students could be set up by the school or societies like the Peer Mentors Group. And we hope that through this method, students will somehow be able to forge friendships, and we're really looking forward in helping with that. Students are also concerned about their home environment and Wi-Fi connectivity, which not every student is privileged to have. And I think the students should be encouraged to get in touch with the school early if they foresee themselves facing such difficulties. Rooms in Ninewells and the library, whether it's in Ninewells or on campus, could be potentially booked with social distancing measures in place to provide students with their necessary resources necessary to get online teaching done. And this is something that's encouraging that the school is looking into to provide study areas within Ninewells and the campus as well. I think that the care groups with the mentors by the different year groups that has been put in place is also going to be really good, and especially when helping with freshers and helping them get assimilated. And yeah, that's about it that I have to share. I think everything else is said in this diagram. I just wanted to add a couple of points.
Fab, thank you, Sheire. I'm going to take over from here and instruct myself to change the slides. So I've been determined over the past few weeks to include a meme in every talk that I've done. So this is this talk's meme. My name's Jordan Napier. I'm the staff development lead for the MBCHB. And I first of all wanted to acknowledge that on this journey of thinking about adapting our teaching at the moment, there's lots of new words getting thrown at us and new terminology. And I felt a little bit like this woman at the beginning. All these different platforms have odd names, oddcast, podcast, webcast, and it can be quite overwhelming. But I just wanted to share that I think we're all in the same boat in trying to grapple with this new language. That always tends to make me feel a bit better that I'm not the only one struggling with something. So it's just to acknowledge that up front. And also just to kind of bring in the optimistic view that from talking with lots of our clinical teachers, and many of them are here today, that this has also given a real opportunity and has been quite a positive opportunity to revisit some of the teaching and to kind of go back to what is core. What do we really want to get across to the students? Everyone knows that it can be quite difficult with a medical curriculum just keeps growing arms and legs, and trying to keep that under control can be a challenge. So this has given people an opportunity to go back to, actually, what do I really need my students to get out of their time with me, and how do I really focus on that? Also, people have been thrown into trying out learning activities that they might have been putting off for a little while. I'm sure we've all been talking about flipped classroom, which Persefoni is going to go on to talk about a little bit more soon, but we've been talking about this approach for a long time, and about how beneficial it can be to both the learner and the teacher. So the classroom has been flipped for us. We've been thrown into this opportunity, and again, I can see the positives in that, and the feedback that I've had from some of our clinical teachers, they're also feeling positive about that. And also the last point on the slide there about the novelty of some of these different approaches to learning are in themselves sparking engagement. Students are curious to see how will this learning session be approached when we're not just in the Ganaki lecture theatre as normal. So the novelty is something that we can actually use to our advantage. And even though that comes with a challenge of it maybe being unfamiliar to us, we kind of have to harness that engagement early on. And this is something that Susie and I presented in our webinar that we did a few weeks ago. And also just on a similar note, that Stella had mentioned the fact that actually the teaching skills and the tools that we're using are still the same. Our clinical teachers are amazing and give our students brilliant learning experiences, and it's just adapting those skills and those tools to a slightly different environment. So all the tools that you usually use for making sure you're getting your learners engaged, that you're adding in springboards for discussion, that you're supporting students, assessing them, we're still using the same toolkit. We're just maybe evolving it slightly and expanding on it in order to fit with the challenges that are at hand at the moment. And also, of course, the tools to aid your practice development, they're still there, and we're evolving and expanding them in order to help you with this situation. So that's, sorry, there was a van tooting outside. I hope you didn't pick that up on the mic. I am going to now pass on to Persefoni to come in and pick up here.
Thank you, Jordan. Hi, everybody. My name is Persefoni Stylianoudaki, and I like the tools that Jordan just showed us, because it sort of reminded me when I was a student, the setting I had in the classroom was very much a whiteboard and a projector if we were lucky. So these tools for our students have, of course, changed. Nowadays, the educational landscape is so much more interesting and innovative. And I put this slide on, some of you may have seen it to some other workshops I have delivered, but I think it's still appropriate to see how much more overwhelmed our students are with information of what happens every minute of the hour. So in my time, we had information from the educator, the library, books, newspapers, etc. But here, except all of these, we've got a plethora of information on the web, social media, etc., that students can go to. But at the same time, that is a positive, because it's something that they're very familiar with. And look at it, what happened now with this pandemic. This is the way everybody in the world is going to using the internet. Next slide, please. So again, we might have come today, we talked some of these, we mentioned some of these words like the digital learning outcomes, the flipped the classroom, etc. And it is all comes under the umbrella of technology and enhanced learning, learning technologies, learning design, etc. And some of these terms can be a little bit intimidating for some people, but for other people, they will be the norm, because we're all at a different level of capabilities regarding digital capabilities. But I would like to concentrate on two elements, the blended and the flipped. If next slide, please, which there are the two terms that I would like to hopefully help you understand a little bit more details today. Next slide, please. Thank you. So blended learning. So you've heard from the Vice Chancellor of the university, the Dean, the senior managers of the school, blended learning. So quite a lot of you might know what this is. Some others might have an idea, some others might hear this for the last few months. So what is it? It's a combination of the traditional and the online modality. So you might have the classroom, the activities that take place and the different methods that you use during that classroom delivery, but you also combine it with some activities that you make available to your students in an online environment. Sometimes that can be in Really, or can be something outside the Really. For example, some YouTube video that you might give them during the classroom that they can do at a later stage. Next slide, please. The flipped classroom, on the other hand, is not it's reversing that order. So basically, you've got your the traditional mode of teaching will be your students will come to your classroom where you deliver a workshop, a lecture, etc., and then you will provide them with some activities to work on. Flipping the classroom means you reversing that process. So you provide those activities and some of these materials you would like your students to prepare beforehand, and then they have the time to think about it and identify their own learning needs. In a way, this is maybe what we might need to, we will help you with in terms of, some of you might already be doing it, of identifying that task, but how do you link that task with what the students do on their own with that classroom that you will deliver? The classroom delivery will take place usually face-to-face, but due to social distancing rules, we don't know what is going to happen. Are we going to go back or not? But at this stage, I will say it can take place in both, either face-to-face and online, and we'll see what guidelines we'll get from the government. And of course, the last stage of it will be where the learners can check their own understanding. Next slide, please. And I try to put this in a diagrammatical way to make it more easy to understand. So some of you already provide students with some learning activities or some materials for them to go online or work on their own. The question is, do you provide some of the learning outcomes? Some of you do, but it will be lovely if we can sort of guide the student what they need to achieve. What is the task that we want them to achieve and learn from it? So when they come into the classroom to engage into a format of a deeper understanding with you, they can ask the questions and they can work in groups. So it will be up to you if you would like to split them, for example, in different breakout rooms that they can work and then come back again all together in the classroom. That can take place either face-to-face or virtually as well, because there are some tools that they do that. And the after process is for the students to check their own understanding, and of course for the educator to ensure that they can make some amendments. They can use that feedback they will get from the students, how the session went, to make amendments for next delivery. Next, please. So that's you. Back to Jordan.
We've put in a couple of different examples of different teaching that has been developed over the past few weeks. Can you hear me okay? Yeah, sorry, I just noticed that my little yellow square wasn't coming up. Some of the teaching that was developed when all this first kicked off, in order to just make sure that our students were getting the best opportunity to pin some of the knowledge and understanding learning that they'd had in the earlier years onto something a little bit more clinical that they would have been getting if they were in the clinical learning environment, but very quickly they weren't there anymore. So I know there's a lot more resources than this out there that have been created. This is just a little snapshot of ones that we were going to share here today and that we've had permission to share. So our wonderful colleagues in obstetrics and gynecology have created some amazing resources, and this is an example of one of them was the virtual labour ward. I had the honour of getting to watch Kirsty Brown start to pull this together, and the first thought was, actually, let's just try and make this as authentic as possible. What are the typical cases that we might have in labour ward all at one time that the students would maybe be seeing if they were with us? And let's just get some good questions in there to get them thinking about how they would approach the management of these different patients. And they combined that with discussion forum activities so the students could check their understanding, clarify things and get some feedback from the tutors as well. So that's one example that that I think is lovely. Second one here, again, and it was to help acknowledge that some of the environments that students would be going into, they wouldn't be able to, and maybe going forward they will be able to, but not in the same way. So this was Dr. Alana Brown-Kerr's virtual palliative medicine hospice workshop. The palliative medicine teaching team, including Fiona McFatter and Fiona Patterson, are really passionate about making sure that students get exposure to these different environments. And Alana pulled together this really lovely virtual workshop that allowed the students to learn a little bit about how the hospice works, what types of patients might be there, but also using really nice questioning to get the students to think about approaches to the different patients that would be in that situation. another great one here was from Prof. Nabi. So we very early on realised that there wasn't a lot of online resources regarding Year 4 urology. We flagged this up to Ghulam and he very quickly was keen to create something. We ran by him this idea that that Kirsty and Katie or in Obs and Gynae have been taken forward of trying to think about the types of patient cases that the students might be seeing if they were sitting with Ghulam in the urology clinic. So he helped design some virtual urology clinics. And it did kind of take the flipped classroom approach in that the students were given some information to read through up front that then would help them work through the cases, come up with their answers, and then kind of discuss those answers with a tutor in some virtual classroom sessions as well. So again, that was a really nice example of a colleague very quickly coming up with an excellent resource that will be really useful going forward as well. And finally, and I think Liz is in the audience today, this is from Dr. Elizabeth Skelly from Emergency Medicine, who I think has been completely converted to blended learning as an approach and has become a complete enthusiast about it, which is amazing to see. And again, she very quickly thought about, okay, what are the students missing by not being with me in the ED at the moment? What types of cases are really important for the students to be able to work through and understand how they'll approach it going forward? So again, really nice patient cases presented to the students on a Monday with questions alongside that to start getting them to think about the different approaches and how they would manage this, and then bring in their answers to those questions to a virtual classroom session on the Friday morning, where Liz or her colleague Jenna Headley would be there to just facilitate the discussion and make sure the students were on the right track. The feedback being that the students really appreciated that opportunity to discuss with the clinical teacher, and I think actually Liz and Jenna really enjoyed these sessions as well. So that's the examples that we've got that have all been developed in this period of time where it was all very quick, brilliant examples of little snippets of blended learning that are working really well and that are there for us to build on as examples as well. So I am just going to start to move us on in our story today to think about how you as a clinical teacher will be supported in adapting to this slightly new way of teaching. We're going to provide links at the end of this presentation so that you'll be able to go to these specific places, but just to highlight that the Centre for Technology and Innovation in Learning, so the kind of central technology support department in the University of Dundee, have some really lovely WordPress-based pages on their website that you can work through to get insights into the thinking behind blended learning. And that's something that I've been working through to inform how I help people with their blended learning approaches. Our incredible TILT team that are based in the School of Medicine have been doing regular drop-in sessions to allow staff to pop in and get support with some of the different platforms that are on use in the School of Medicine. So Delta, Blackboard Collaborate, the discussion forums, they're doing that regularly for people to bring along specific queries. Our good old-fashioned core skills has had a bit of a reboot as core skills 2.0 to include aspects of blended learning, and it will be run in a virtual classroom way rather than being squeezed into the tiny little teaching room 5. And finally, there's a new offering of a blended learning bootcamp, which is going to help specifically clinical teachers think about understanding blended learning and actually implementing it into their practice. And I will hand over to Persefoni to expand on that a little bit.
Thanks, Jordan. So blended learning bootcamp sessions. So there are the sessions that will be in the first instance 4 sessions, and the idea is you get an insight into what learning is. We'll cover some of the existing frameworks, the techniques, with some examples. And then after the first session, then we'll go into more deeper elements of what is it that you're trying to achieve, what do you currently do, start helping you to start think how you can blend your own teaching content, and only to the levels that of course you're comfortable with, because we will show you some examples, we'll show you some techniques, and you will be provided with some material you can work on, and then come to the session to sort of go through these steps with us. Because we talked about, and we also Sheire mentioned about video resources, we thought that we would like to go into a session just for how to create this type of video resources, because it's quite important to give staff that confidence to show you that you don't need to be an expert in producing media. You can do it with simple techniques, either using some of the university packages or some of your own devices as well, and super easy. Some of the stuff we will take you through, and of course how the communication will differ online from face to face, and how you can be safe, how you ensure your students are safe and there is a social presence, and at the same time how you can communicate that elements you want to communicate in an accessible format as well. And next slide please. These are mapped to the GMC framework for trainer recognition and will be delivered predominantly by myself and Alison Gray, who is a member of the TIL team and at the moment also in placement with CITL as well. So Alison will bring that useful experience she's got from that team back to the School of Medicine. Thank you. Next slide, please. So the format of the sessions, what will be? Well, it will be a blended format delivery using the flipped classroom approach we just talked about. Hopefully by now you remember what flipped classroom is. It means that you will be given some material and instructions before the session, approximately 2 days before the session, to walk through it. We will recommend a 30-minute time, if you can allocate, to prepare yourself before you come to the live classroom. And when you come to the live classroom, hopefully by then you will have already worked through material, thought about it in your own context, write down some of the questions, and when you come, we can go into that deeper learning element. And the online sessions, we expect them to last approximately 9 minutes, although I will advise you to add a little bit more in your calendar in case there are a lot of questions, so we might run a little bit over, pending the amount of questions you will have for staff. Next slide, please.
And again, so just to flag up that, so Core Skills will reboot come August, no longer in room 5, now in a Blackboard Collaborate classroom, keeping the same rough structure, but adding in elements of blended learning, nice and informal, all fully mapped to the GMC framework, delivered by me with support from Dr. Claire Stubbings and sometimes Dr. Mandy Moffat as well. And you still book onto these from the same place that you would have booked onto the face-to-face workshops going forward. So the link is at the bottom of that slide, but I think it's also on one of the slides coming up too. Also, just to flag up to you, if you've not already seen these, that the Centre for Medical Education here in Dundee have been doing brilliant outreach webinars on different aspects of online learning and approaches to this. And you can access all of the webinars via a YouTube playlist, and you can also sign up to attend the ones that are still due to run live. So there's a link for that at the end as well. But these are a brilliant resource for getting you to start thinking about aspects of this. And I suppose the way you engage with it via YouTube, you can kind of skip through it in your own time and use the bits that are most relevant to you. And here is all the different signposting that we've done throughout this talk today. So you've got the link there to the Bookwhen page where you can sign up to the bootcamp or Core Skills. You've got the link how to find the Tilt drop-in sessions, links to the different CME resources there, and finally the link to the brilliant CETL Learning X website as well. So at this point, I think we're just going to do some questions. Yeah, thank you very much for listening.
Okay, thanks very much to the whole team for that thorough run through of what's going on in the medical school. So there are some questions that have appeared in the chat box. Someone called Mark has said, a question for Jordan and the education team: how will blended learning be reviewed? Will all students be encouraged to formally rate and review the sessions? I feel this is vital to new sessions and worry the importance of it will be diminished. Thank you for everything you're doing. It is appreciated. So what's the feedback process? Presumably from the students.
I am wondering if it'll be similar to what the process was before this, in that there was always formal evaluation done on the different system blocks and the different clinical attachment blocks. I'm sure that will be continuing and will be adapted to make sure we're picking up on any challenges with the blended approach. I've also been encouraging individual clinical teachers to think about how they're evaluating continuously rather than waiting for the official medical school feedback to come back, because the timeliness of that can leave a bit of a gap. So it's either, it could be really quick evaluation of just asking students if the environment is comfortable enough to say, okay, how did that work for you? Is there anything that was missing? Was there anything as part of that process that you think you want me to adapt for next time? Or it could be asking them to fill out a quick anonymous evaluation form. So yeah.
One of the tools that we've used in the MCN, for example, is Menti, a very simple, effective tool where people can vote with their phones or whatever device, and it just gives you a sliding scale of how good was this session. And if it's 9 out of 10, great. If it's 2 out of 10, then that triggers a further discussion. So that is throwing yet another different system into the mix, but perhaps that's something that can be looked at. Lots of questions now appearing. Chris Pell, psychiatry, says, related question for the team and Sheire, do we know what students think of what has been created and delivered so far? Are we doing it right? So perhaps a related question. Is Sheire still there?
Yeah, Sheire, do you want to come in on that one?
Yeah, sure. So for myself, the only online teaching that I've sort of received was during the transition block through the anatomy tutorial. So that was really useful because they used quizzes and they got really involved with the students through polls and such. There were some formative quizzes on Delta for the transition block, which was helpful as well. But I think the people who are getting the crux of the online teaching is the fourth years at the moment. And I think from what I'm hearing from several students, so it's a small group, it might not be representative of all the students, is that, some lectures are really good and some lectures are not so good. And the lectures that use quizzes or diagrams that facilitates more of a conversation, is more beneficial. And I think Dr. Orr created a virtual obs and gyne ward. And I think some fourth years found that really useful because you can sort of work through it in your own time and complete the questions. So I think some people seem to be adjusting faster than others. I think it really depends. I think it varies across lectures from what I'm hearing.
Thanks, Sheire. One question from Natasha Usher is, please could we have a link to the further info sent up email? I will absolutely do that. I have the slides. I will append these links onto the YouTube video and I'll send out an email to everyone so you can all have the details. That's fine. Spencer asks, will there be a timetable for sessions or will it be more self-directed? Stella, perhaps you're the person to answer that.
Yeah, thanks for that question. Students highly value a timetable to guide them, and having a timetable that shows the synchronous, so any elements that are planned to be face-to-face will be timetabled, but also those elements that are synchronous, so the real time, they actually need to be at a device in as best an environment they can get into, has been fed back to be important, and that's also the university wide stance. I don't know if I could invite in any colleagues who are in the call from the MBCHB team to add comment. The other part I'm noticing there's questions coming in as well about lectures that would normally take place, and I just wondered if colleagues from MBCHB team might want to say a little bit about what will be the priority activities that are face-to-face in classrooms, that might be helpful as well, connecting to that point, which is about what is timetabled and scheduled. I hope I'm not putting anyone on the spot there, but I think we've got colleagues from MBCHB leadership team and clinical skills as well. Is that
stick their head
throwing it on?
To that. Anyone in the room? Oh yeah, Maggie, on you go.
Yes,
head of the undergraduate program.
Yes, I am. I haven't got a very specific answer, except that we're working on those aspects now about what's timetabled and what is more self-directed. And we'll obviously be working very closely with all of the block leads and system leads and teaching leads on that. So I can't tell you kind of chapter and verse right now, but just to reassure everybody that we are onto it, and we will be sharing that information as soon as we've got it all together.
Jen Kennedy, who's SIP lead, has put in the comments here that in years 1 to 3, face-to-face areas will be anatomy, dissection and clinical skills. So those were the priorities for the face-to-face things. She's just adding to that. The question from the enigmatically named iPhone: are the lecturers that normally play, oh, that's a green quest, that's already been asked, fine, I'll move on. Will the sessions that are going to be delivered face-to-face be live streamed for those who can't attend? I think we've already answered that as well. So does anyone else have any other questions that they'd like to throw in? You can even do it by speaking if you like. Oh, here we go. Here's an interesting question from Suzanne. A question for Sheire. How do students feel about turning their cameras on during online sessions? I can tell you that during this grand round, there are not a lot of people with their cameras on. In fact, there's 4. So I think a lot of people don't like having their screen on. Sheire, what about the students?
I don't know, just from my perspective, I think it depends. Like if it was my small group, like my tutorial group that I'm familiar with and stuff, I would be fine in turning my camera off. But if it was a mass lecture, I wouldn't turn my camera on. I'd probably be in bed in my pajamas and just be doing lectures like in that way for that reason. So I think it just matters and how familiar you are with the people you are on the call with.
In the clinical world, we've been doing a lot of these near-me Tayside appointments, and it's remarkable how many people would rather do it on the phone than with a camera. And they give exactly the same reason. Well, I'm in my pajamas in bed, I don't want you to see me. I think it's very interesting. Is there a preference? Andy has asked the question I was going to ask, which is there a preference for which platform will be used? My computer taskbar has on it Zoom and Teams and BlueJeans and Citrix, and there's more coming. So, and Sheire mentioned about the feedback systems, and you've got Padlet and MedBlogs. And so are there any, is there going to be a single dedicated platform, or is that decision being made? Is it being made at a university level or a medical school level? I think we all have our preferences. Clearly my preference is to use Zoom because it's very easy to manipulate at this end, but perhaps Stella or Maggie might be able to answer that.
Yeah, I can say, yeah, talk a bit to that. Something Jordan, Persefoni and I were talking a little bit about before. I think it's understood that the significance of the body of work that's happening right now means that we're not fundamentally disrupting the use of med blogs and the use of Delta, which is the Moodle platform, as primary areas, one for content sharing, resources, and the other connected piece to the more synchronous discussion, debate and interactive elements. And so within that, the medium, which will be the University of Dundee supported platform for conversations and dialogue, would then be Collaborate, Blackboard Collaborate. But also to note that here we all are, we're using Zoom successfully. And as Jordan was pointing out, where there might be workplace-based related meetings or tutorials or conversations, and they're fundamentally led by happening within NHS that would involve students who are learning by doing within that workplace-based setting, then that is an appropriate medium to use so that they can be part of it. So other things that are coming, which have already been mentioned, the use of Mentimeter, which is being supported institutionally, which I think is very positive in terms of student engagement. There are other resources connected to online packages that I think are looking to be secured, which will give us additional tools, in particular related to anatomy. I don't know, Jordan, if you want to add more, or other colleagues who are here.
I think you've summarised it quite nicely. I think Susie Schofield wants to come in with a point.
Yeah, it was, can you hear me okay?
Yeah.
Because I understand my mic's not been brilliant this morning. So it was sort of going back to the timetabling, but it also overlaps with this. Obviously, as teachers, we need to be very aware of the learning outcomes that we need to be covering, irrespective of the modality that that's going to be through. And thinking back to, you know, what we put through QASC, through quality assurance. The students, as Sherry's already highlighted, really appreciate some structure, the timetabling, making sure you're not overloading them or underloading them, giving them some idea of how long those asynchronous activities should be taking. I think also having some sort of timetable, sharing with the students that timetable that you've worked out for them, even though, you know, they can then use the asynchronous activities, they can do them at different times. It does as well show them that ordering. So a bit like thinking back to the flipped classroom, Persefoni has said, you will be sent this stuff 2 days before, and you are expected to read it before you come to the synchronous session. So remembering that, just as, I mean, you know it all from your face-to-face, but, you know, it's just making sure that all those things are carried forward. So when we pivot to a more blended model. I'm leading a piece of work in the university on attendance monitoring and engagement. And so we are at the moment discussing about how we monitor students' attendance and engagement, not in a big brother unethical sort of way, but, you know, to make sure that you're feeling fully supported. You know, when you're in a face-to-face room, when you're in a lecture room, we can see you, we know you're there. What happens if you sort of drop off our radar? Are you having technical problems? Are you having, you know, other sorts of problems? So we are very much looking at how we do that and working and getting a student voice on that as well, obviously, from DUSA. But yeah, so that's what I wanted to say there.
Okay, sorry, Said, you have a comment, I think. You're muted, sorry. You're muted, we can't hear you.
I just wondered if there has been any GMC directive regarding this change in our method of teaching.
I don't know, Maggie, it looked like you were about to speak on that one. Or am I just throwing over to you? Is that okay?
Yes, there hasn't been any specific GMC directive. The GMC continues to expect us to help our students to meet the outcomes for graduates. But how we do that is left to us.
Right, thank you.
Okay, it's 2:01, so I'll draw things to a close. Thanks to everybody for the presentation, and thank you for the question session. Now, Mark has said in the comments just there is an official place where we can feedback the things raised in this talk and chat. I'm not sure there is any super easy way to do that, but if you have any comments you want me to pass on, please just email them to me. I'm very happy to just pass them on to the team. I'll be the conduit for that. That's not a problem. And if people want to be involved in more discussions, I'm sure the medical school will be happy to have some you know, group discussions and engage people in the discussions a bit more. So send the stuff on to me if you've got anything. Right, that draws everything to a close. We've got Grand Rounds is on again next week. I think it is Munro Stewart for a GP in Tayside. He's going to speak about the Lancet Commission on climate and its effect on medicine, and he's bringing with him the lead author from that commission. So that's very exciting. Jordan, do you put that Padlet up so that people can go and comment? Is that what it is?
Yeah, please just use that Padlet to post any comments or questions. And if you want us to get back to you, you could stick in an email address if you want to be identified, or you could use it anonymously.
Okay, so that Padlet there, capture it now before you log off, or I'll put it in the email that I put out at the end, and I'll stick it into the comments in the YouTube video as well. Okay, so either email me, use that Padlet, or contact the team directly. Thanks very much, everyone. Enjoy the rest of your afternoon, and have a good weekend.
Thanks, Tom.
Thank you. Bye.
Bye, everyone.